So IVF, or in vitro fertilisation, is a treatment which has been around since the 1970s, and over that time there's been year-on-year refinements of the technique. Essentially what it involves is the woman taking stimulation, daily stimulation by injection, to stimulate her ovaries for around about 2 weeks. We then take the eggs from her ovaries and we fertilise them in the laboratory with sperm to make embryos. We then grow the embryos on in incubators for a few days, between 2 and 5 days, and once we see that there's 1 or 2 best quality embryos to put back, we then replace those using an embryo transfer procedure. That essentially is an IVF cycle.
1 in 6 couples has problems conceiving, and the Oxford Fertility Unit, or OFU, receives over 2,000 referrals per year from across the UK. These referrals come from GPs and private practitioners, and the first contact a couple has with the OFU is a face-to-face meeting.
Initially, you'll see a doctor here to discuss what treatment options are going to be best for you. If it's IVF, whether it's a more straightforward treatment like intrauterine insemination. Having done that, if IVF is deemed to be the most appropriate form of treatment, there are a few tests and investigations that we're going to need to do. So we'll need to ensure that the quality of the sperm is good enough for treatment. There are a range of hormone blood tests that will be required. Some of these are done at specific times of your cycle, so you may need to go to your GP and have those done in the first half of your cycle. You will then be seen for what we call a nurse planning appointment, and we will go through all the consent forms with you that are required to ensure that you are fully informed about your treatment. We will run through the risks and side effects of treatment and actually plan when you're going to start. As part of that, we'll do a vaginal ultrasound scan so we can assess your uterus and your ovaries, how efficiently we think they're going to function, and answer any of the questions that you may have for your treatment cycle.
An IVF cycle is essentially split into 4 distinct sections. First, stimulation. Then, fertilisation. Next comes the embryo transfer, and then there's the aftercare. The first phase of IVF is where the female patient's ovaries, through careful hormone ingestion, are encouraged to stop ovulating and then stimulated to produce multiple eggs. This delicate and critical process is monitored, so the consultants know when the eggs are perfectly mature and ready for the final part of this preliminary phase, which is egg collection.
So if a woman's going to have long protocol IVF, that means we need to downregulate the hormones which drive her ovaries on. And the way that we do that is we use a drug called an agonist. And this agonist drug can either be given by a sniffer or a daily injection. And after about 2 to 3 weeks, it will have switched off the hormones that come from the pituitary, which is a gland in the head. And therefore, because those hormones are switched off, the ovaries will be switched off. We can then move on to the next stage of her IVF cycle.
Once your hormones are at baseline and we're happy that everything is ready for you to start your stimulation, we will actually teach you how to inject the drugs you're going to need to stimulate your ovary. That dose of drug has been prescribed by the consultants and is based on your age, your weight, your height, your own levels of follicle stimulating hormone, and how your ovaries appeared on your baseline scan, so how many little follicles there were on your ovary.
If she's had any fertility treatments beforehand, then we'll also look at the outcome of those drug treatments to see how she responded to those drugs. And we therefore choose a starting dose of stimulation which is most appropriate just to her. When she comes in for her monitoring scans, either in Oxford or in the satellites, then again we will review the dose she's on, and a consultant will take a decision on whether to alter the dose of her stimulation as she goes along. Because what we're aiming for is not over or under stimulation, it's a sort of a healthy, happy middle ground.
Most people will inject for a minimum of 8 days before coming for their first scan. And your first scan will either be on a Wednesday or a Friday. At your scan appointment, we're looking to see how your ovaries have responded to treatment. So we will again do a vaginal ultrasound scan. We will measure the thickness of your endometrium because now it should be getting thicker. We will measure the number of follicles on each ovary and measure the size. And we will also do a blood test to check your hormone levels. So we're looking at your estradiol levels. As your egg develops within each follicle, they produce estrogen, and we're going to measure that to give us another indication of how mature the eggs are in the follicles.
So many patients, many women are understandably very worried about the egg collection. They're worried, is it going to be very painful? Are they going to be awake during the procedure? Fortunately, we've arranged that there's a consultant anaesthetist present for all of the egg collections. And on the day of the egg collection, the patient, usually with her partner, will come to the Oxford Fertility unit. They'll be given a private room, and then the doctor undertaking the procedure and the nurse involved will come and introduce themselves, explain the process, and ask the woman to sign a consent form so that we can then move on to the actual egg collection procedure. She's then taken through to the egg collection room, where again the anaesthetist will say hello, take a quick medical history to make sure everything's fine. We'll have looked through the notes, and then we'll put a drip into the woman's hand or arm to give some sedation through. The embryologist will check the patient's name and details. The anaesthetic will then be given. Once the woman is sleeping and is not aware what's happening, then from our point of view, from the doctor's point of view, we'll then move on to the egg collection procedure. A scan probe is put into the vagina and we look at the stimulated ovaries on the screen. And then we pass a needle through into each of the follicles and drain the fluid out. And then the fluid from those follicles is passed through to the lab. The procedure takes about 10 to 20 minutes usually. The patient then goes through to a recovery area where a specialised recovery nurse will ensure that we'll monitor all their vital signs. They may be there for another 15-20 minutes or so before going back through to the initial private room that they first went to. During the time that the egg collection is going, if there's a male partner there, then often he'll be asked to produce a fresh sample, unless there's frozen sperm that's being used.
After the eggs are collected in theatre, they're placed in incubators in the lab. This is where the next important step in the IVF treatment takes place: fertilisation and embryo selection.
Fertilisation takes place on the same day as the egg collection. Once we have the eggs, and those eggs are put into an incubator, which is at body temperature, so 37 degrees centigrade. The process actually takes the live sperm away from the dead sperm. So again, it mimics what would happen in the body in that the live sperm will swim to the site of the egg. So what we're aiming for in that preparation process is to have a nice live preparation of sperm that we can then use to fertilise the eggs a little bit later that same day. And that is where we ensure that the eggs and the sperm have actually met. So we put them together in the same dish. There's about 100,000 sperm put with each egg. Hopefully one of those should then be able to fertilise the egg overnight.
Fertilisation is successful in the vast majority of cases, with only 2% of patients experiencing total failure. The development of the various embryos is closely followed by the embryologists before the next step of IVF, which is embryo transfer.
Once we know we have fertilisation, at that point we have an embryo. We will obviously let the couple know how many eggs are fertilised, and at that point we can then set them up for their embryo transfer.
We then culture the embryos on for a few days. And what we're trying to do is to push the embryos on until we really see which are the best ones to go back. And that normally lasts for 2, 3 or 5 days. Once we see there are sufficient embryos of good enough quality to go back, then we'll ask the woman to come in for an embryo transfer. Usually the partner comes along as well and is in the room for the embryo transfer, we call it an ET. No anaesthetic is required for that at all. It's really a bit like having a smear test. And during an embryo transfer, what we do is we put a speculum in the vagina to clearly look at the cervix. The woman needs to have a full bladder for for the embryo transfer procedure because we use an abdominal scan probe to look through her bladder, to look at the womb, to help us make sure we're doing the embryo transfer into the optimal place within the womb. The lab will then come through, introduce themselves, give the patients an update as to the quality and the number of their embryos, and then we'll be putting very often the best single embryo back, but sometimes 2 embryos back into the womb, using a syringe and a catheter through the neck of the womb.
We can actually only see on the ultrasound scan the tiny drop of culture media that surrounds the embryo. So we pass the catheter back to the lab and they will flush it through and confirm that the embryo has actually left the catheter and it's safely in your uterus. We will then talk you through the next 2 weeks while you wait for pregnancy tests, which is obviously quite a worrying time for you. But we'll talk you through the things that we think that you can do and you can't do.
As soon as we finish the embryo transfer procedure, then the woman can get up and head off home. But we'll have sent her home with a pregnancy testing kit, a urine pregnancy testing kit, and also very clear instructions on what to do next. And the pregnancy test is done about 16 days after the egg collection. And we'll ask the woman to phone in either to here or the satellite unit, depending on where she's had treatment, with the result of her pregnancy test. If, fingers crossed, she's pregnant, then a pregnancy scan will be arranged a few weeks later. If she's not pregnant, then we'll have a discussion with her over the phone about possible next steps. And it may be that the patient or the couple want to return to here or a satellite unit for a consultation with the medical or nursing team, or to see the counsellor, for instance.
OFU provides counselling which is available before, during and after treatment. We are very much geared to look after patients for whom IVF fails, as well as for those for whom it succeeds. Even with the onset of pregnancy, our commitment and involvement does not diminish.
There are risks associated with any pregnancy. 1 in 5 pregnancies potentially will end in miscarriage, and that doesn't matter whether it's a pregnancy conceived using IVF or a natural conception. If you're lucky enough to have a positive pregnancy test, then we will need to speak to you and arrange a early pregnancy scan. We normally scan you about 3 weeks after you've telephoned with your pregnancy test. This is when you're approximately 7 weeks pregnant, and we can then be assured of seeing a fetal heart and a gestation sac. Unfortunately, not all positive pregnancy tests will continue on to a successful healthy baby, and there is a small risk that you may have a miscarriage between your pregnancy test and your first scan. If everything, however, is all right with your scan when we see you, we will then do your paperwork and discharge you to your GP, letting you know the date your baby is due.